Hi, welcome to Fertile Minds. My name is Dr. Marcella Martin and I work at IVF Australia. So today we're going to talk about embryo transfers. Embryo transfers are a really exciting time in your IVF journey. And so people often have questions about this moment. So let's take a moment to discuss it. The most common question people will have is whether a frozen embryo transfer versus a fresh embryo transfer differs much. It certainly doesn't differ in the actual moment when we're putting the embryo in. The lead up to both those processes, though, is what the difference is. So a fresh embryo transfer is when you've just had your IVF cycle, and on day 5 after the retrieval, we're putting an embryo in. On a frozen embryo transfer is where we've had embryos frozen from that event, and at some point in the future, the embryo is thawed and popped in. On the day of your embryo transfer, you will be asked to attend the hospital where your embryo is stored at. We will ask you to have a semi-full bladder because when you're inside, we're going to do an ultrasound of your uterus. The reason we do that is so that we can be sure that we're placing the catheter into the uterus in the correct position. So when you come into the room, you'll be asked for your ID check, and then the doctor will instruct you to take your underwear off and a speculum will be inserted in the vagina. At that point, there's going to be a small catheter inserted into your cervix, and behind the doctor, the embryo that is about to be inserted will be shown on a large screen, and identity checks will be done one more time. The scientists will then retrieve that little embryo into a thin little droplet of fluid, and that's placed inside a thin little tube. That catheter is inserted into the one that's into your cervix. It only takes a couple of minutes. It's over very quickly and it should be painless. Once the embryo is in, we can verify that everything's in the right position because you'll have an ultrasound next to you and you'll be able to see the catheter moving into the uterus. And then at that point, the transfer's done. After the embryo transfer, you can get back to all your normal daily activities. You can go straight back to work. You can just carry on life as per normal. Remember, had you fallen pregnant naturally, you would be none the wiser at that point. So that's why we encourage you to just keep living life as per normal. Fresh versus frozen embryo transfers. The success rate in a really good laboratory is going to be the same. There can be really good reasons why you need one or the other. There are safety aspects in cases where you might have a high egg count at your egg retrieval, where we definitely want to do a freeze-all. We don't want to push your body too hard and risk a thing called ovarian hyperstimulation syndrome. The frozen embryos are stored at the hospital at which you have your egg collection. The facilities are purpose-built to keep those embryos safe. If you're having a frozen embryo transfer, there can be different pathways or preparation pathways that your fertility specialist might ask you to do. For those girls who have a lovely 28-day cycle, we might just use a natural cycle and not actually give you any medications, but just monitor you to pick the right day to then plan for the transfer. Other women will require a little bit of hormone, of the FSH hormone, to help their lining develop well and to make sure that the uterus is ready to receive an embryo. And the third line might be that you might need hormone replacement therapy so that we can keep the lining nice and steady all the way through the cycle, making it easier to then decide when to put the embryo in. So there's various processes out there. In most cases, on top of all of that, a fertility specialist will give you extra luteal phase support in the form of progestogen, which starts a few days before your embryo transfer. So the day of the embryo transfer can vary from woman to woman. It's not one magical set day. So we have to forget about our cycles and allow us to sort of just monitor and pick the right time. So what we're looking for when we're looking at your cycle, we're going to do bloods and ultrasounds to monitor you to see when your hormones are peaking. And plus we're doing an ultrasound to keep an eye on the lining. We want that lining to be nice and thick and fluffy before we place an embryo in there. So understandably, you might be tempted to do a pregnancy test at home before your scheduled blood test. And that's okay, but sometimes you can disappoint yourself because that beta-HCG hormone may not be high enough to detect on a urine test just yet. So be careful with doing that. If you get a negative urine test, hang in there. Still wait for your blood test, right? And so don't give up just then. Thanks for watching. For all things fertility, feel free to subscribe.